My question, I'm Paul Clark, I'm the Facilities Manager for Betsy Cadwallader University Health Board in North Wales. My question comes to Phil really in regards to the approach of the four nations in regards to the food standards agenda, and at what point do you think we may get to where we have one standard for the four nations?
Great question. I wish it was now. You know, obviously with Kay here on HEFMA, speaking on an HCA point of view, you know, we are very much a four nations association, and we do have those conversations going on quite regularly. But I know Emma and I are very keen to have a consistent level of standards in every area that certainly concern us across the four nations. It's a tricky one. It's a tricky one how we do it, but I think some parallels can be drawn. And I think, and I know next week we've got conversations with Fiona and Simon, haven't we, around how we sort of manage the standards going forward. But I think also the conversation needs to be, you know, can we have those conversations with the other nations to ensure that we sort of start to pull things together a little bit. I know certainly I've spoken to colleagues in Scotland, Ireland and Wales, and there's just so much learning for us. We're all at different parts of the journey. You know, some are further ahead on some topics and some are further behind. So, you know, why would we not learn from each other and you know, and take the positive and walk that journey together? So, yeah, really keen to have those journeys, but we're certainly not there right now. Hope that helps.
One of the things that I've been working with is the sustainability subject towards net zero, and the reduction of single-use items, particularly wipes, cloths, etc., bring us back to the area of reusable and the role of laundry and decontamination in that area. This was part of my work at UCL, you know, some time ago with the introduction of microfiber. Is where do we go with this in terms of developing the evidence for the new types of laundries? Everybody thinks about big laundry systems, but obviously technical textiles of microfiber laundries have changed over the years, but nobody has them. So is the model for external creation of these things, of having satellites or bringing these in to hospitals themselves, again, with the variance of the types from a trust down to local community care, how do we provide that safe facility and affect you know, behavior change, firstly, to remove convenience of wipes and to bring forward this introduction of reusables as distinct from single use? Sorry, it's a long question, but you know where I'm going with it.
Okay.
Yeah.
No, I think reusable is the way forward, and I think we can launder to make items microbiologically safe. So we have that knowledge and we can do that. I don't think it necessarily has to be big off-site laundries. I think care homes could have on-site, as could hospitals, as could even providers of the cloths. They could launder and send back and have rental, much like the uniforms. I've been working for the last 2 years, funded by the global trade bodies for textiles, but led by the Textile Services Association, to develop a standardised protocol to ensure that all laundry systems are microbiologically safe. So this test standard hopefully should be published this year, well, next year, 2023. So the idea is that any laundry, regardless of where they are or what they're laundering, is able to test their process to ensure that it is standardised and that they're meeting a standard microbiological result. I think once that's implemented, it opens up the opportunity for people to launder and reuse items as long as they're able to meet this test standard.
Thank you. Well, I'm sure there's a sigh of relief from infection prevention and control in the room. Thank you.
Katie, just a couple of points. I'm Reg Ramsden. I'm the laundry manager at Sheffield Teaching Hospitals. So we do have an industrial laundry there. And we do have changing rooms for the nurses. And we do have issues to standard on uniforms so that they can actually take them home. And agreed, it's still not getting done. You mentioned there on removal, you didn't mention anything about killing the germ. Can you just clarify what you mean about removal? Because obviously C. diff's not killed by temperature, so it's literally washing it down the drain.
Yeah,
So,
absolutely. Yeah, no, completely agree. When we're talking about laundry, most of the removal, which isn't kill, is through agitation and dilution. And that's why when you're seeing in a 40-degree wash, you're seeing cross-contamination of other items in the wash, because basically the microorganisms being lifted and put onto another surface. We did a big study from bedsheet, from hospital patients, C. difficile patient, through industrial launderers some years ago. That's been published for a while now. And that is exactly what you said. The spores are surviving even industrial laundering. So it's about removal. And this is part of the issue and why the global trade bodies decided we need a standardised test, because everyone was using their own tests. Some were doing swatch tests, which was removal. Some were showing kills. So the test we've developed actually shows kill because it's a bioindicator that's in an enclosed system. So when we're testing processes, whether it's for new laundry processes, for its existing laundry processes, it will actually be testing kill of the laundry process rather than removal for agitation and dilution. And what the beauty of this is at the moment, particularly industrial laundering, is using 71 for 3 minutes. They're relying on some chemistries, but they want to reduce those temperatures because of the environmental impact. So using this test method that we've developed, as long as their process shows kill, so it could be a lower temperature with a particular magic formula or detergent or whatever it may be, then that should resolve that issue. So we can start moving to more environmentally friendly laundering processes. And what we're looking at in the near future, we've just had the funding for this, is how we overcome the issue of spores within those laundry systems.
just when you're talking of something being developed, obviously the TSA is very much hotel-based. Have you actually been to any of the healthcare launderers, either the big ones in Elise or Synergy, and what they're doing? Because obviously sending uniforms to them, Elise took out all of their tunnel finishers some time ago, so they can't actually iron them to send them back. So there's an issue in that for trusts. And also, you're saying about developing all of these changing areas and actually then putting uniforms back through these industrial laundries. Who is going to fund this? Because that's a significant number, possibly 70 or 80,000 pounds a year that's been taken out of the system. And are NHS England going to fund that, or are the trusts going to fund that? Who's going to put that money back into the system?
Absolutely. We work closely with Elise and Synergy, and I've visited those laundries and some overseas as well. And they've got members of their team that are in the advisory panel for the test standard that we've been developing. So they're not directly involved in the research, but their expertise are coming across. So absolutely, yes, I have visited a healthcare laundry.
Just you're talking of the test standard.
Yeah.
Is EN 14065 and HTM 0104 not good enough now? Because obviously they've been in the industry for some time, and they talk about biocontamination controls. And personally, we test on a regular basis through a laboratory, as do Elise and everybody else. So is this just overkill by another test standard coming in?
No, absolutely not. 14065 will still be there, and the microbiology test is going to hopefully be an appendix of that, and it's only for when there is change of process or periodic testing, so say quarterly, or when you want to change processes within your laundry to prove that that process works, and then you just follow 14065 as you normally would have been. We took advice from all of the trade bodies globally, who do have a large healthcare representation, not just hotels. So we have taken advice on that, and those experts have been involved in this process the whole way through.
Ashley Harrison, for Principal Service Assurance Manager for NHS Property Services. Question for Phil. With the new food standards, is there an implementation timescale similar to the new cleaning standards where organisations need to be compliant with them?
That's what we're working through at the moment. We've talked about possibly a reporting schedule through either PAMeric or Place, so that will be discussed next week. We know that letters have gone to EFM directors, given them a sort of an in-house time frame of 6 months, so at least they can start to work towards that. I mean, originally we were talking about secondary legislation, but at the moment we're not in that position. But it's probably just about tiptoeing through at the moment, finding out where trusts are, getting the feedback from them over the next few weeks, and then we will shape a way forward. I mean, personally, Ashley, I obviously work with Emma and Anna and yourself around the cleaning, and I thought the derogation action plans for those trusts that were really struggling worked well, and there's no reason why we couldn't do that. So I think there will be a similar way of managing it. You know, it's that balance, isn't it, of managing, supporting and directing, and I think if we can do that, then hopefully we'll gauge the way forward.
My name's Philip Molyneux from Glenclwyd Hospital in North Wales. My question is for Katie. Your research, I'm just wondering where it's fed up to in terms of our next pandemic and the preparedness for it, and just give us some insight into that, please.
Well, it really depends what microorganism our next pandemic is. I think preparedness, I think we need to build back better, don't we? We need to learn lessons. And I think some of the fears and the attitudes and things have changed over time because we have greater understanding. And we've had pandemics before from epidemics from other microorganisms where there's been some knowledge base there already. However, with coronavirus, there was limited knowledge generally in the published literature. So we did have a few, we had a few experts that had done some things, but a lot of the research was starting from little understanding. So it's quite hard to say how we're prepared for the next pandemic because it's not just laundry, is it? Actually, laundry is most probably minimal in compared to everything else. So that's a bit hard to answer.